I started researching endlessly.
Breath.
Sorry about that. I started researching endlessly, and obviously I decided to study homeopathy. And yeah, I just became really fascinated in health in general, but specifically female health, which then grew into obviously gut health and mental health as well. Okay, so I created this course for women like you and like me, quite frankly, because of what I went through. I can kind of understand the what it feels like when you are left to figure it out and you feel very alone and kind of just dismissed a lot of the time. And I think the message that I really want to get across to my patients and pretty much anyone listening to this talk is that you don't need to fight your body, you need to understand it. And I hope that after this evening, people can kind of feel that message a little bit more. Okay, all right. So if you signed up for this course, you can probably relate to one or two of these symptoms. So what we generally see is that symptoms don't show up on their own. So for example, you won't just have bloating or just PMS. It'll generally be kind of all of them. And it's pretty much impossible to treat them in isolation. So when you have a variety of symptoms across multiple different systems, that's when it becomes so important to look at gut health. Okay. So a lot of the time, patients will come to you and they'll say, like, I just feel off. Like, I'm not really sure what's going on. And then when you start looking at it, then you'll start to see these different symptoms in the different systems. Okay, so when we look at the long-lasting symptoms like PMS or anxiety or fatigue, for example, you can't really look at them on their own and you can't treat them on their own. And that's what people generally do. So, for example, if you have anxiety, you'll take a sedative. Or if you have irregular periods, you'll go on the pill. Or if you have fatigue, then you'll just have another cup of coffee. But it doesn't actually treat what's going on. So, what if these symptoms aren't isolated symptoms, but they're an intricate system? Okay, so think of it like a three-way communication between the gut, the brain, and your hormones. Okay, all right, so let's start with the star of the show this evening, the gut. It's also called the second brain for a reason because it plays such a massive role in mental health, which obviously we're going to chat about a little bit more. So when we talk about the gut, technically it is a very long tube that goes from the mouth all the way down to the anus, right? Technically that is true, but there is so much more to it. It is so much more intricate than that. Okay. So the components of the gut that most people know about is nutrient absorption. So the reason we eat is to try and get fuel and get nutrients from the food that we eat. And that's what the gut does. The problem is if the gut is inflamed or the gut just isn't doing so well, nutrient absorption doesn't happen so well. Okay. And when we aren't absorbing nutrients properly, we start to develop deficiencies. So that's when you can start to get like low energy and poor mood and hormonal imbalances and that type of thing. So that's the first place where we start to see the overlap between gut health and hormonal and mental health as well. Okay. The point that we need to mention here is you can have a flawless diet. So you can be eating the best quality foods and only eating healthy foods. But if your gut is inflamed, you're probably not absorbing all of the nutrients in there. So it's not really what you're eating all the time, it's what your gut can actually use. All right, and then we get to the different components that most people aren't actually aware about. Okay, so the first one is that the gut is actually responsible for producing a lot of the chemicals that your brain needs. Okay. So a lot of people know of serotonin. Serotonin is your happy neurotransmitter. Okay. It's the one we work on when we're treating depression. 90% at least of serotonin is produced in the gut. So you can see why when the gut isn't happy, the brain's not going to be very happy either. In addition to serotonin, we look at GABA and dopamine. Now, GABA is your nice calming neurotransmitter, so it's kind of counteracts anxiety. And then dopamine is the neurotransmitter that's responsible for pleasure and reward. And GABA and dopamine levels are heavily influenced by the gut microbiome, which we're going to chat about a little bit more just now. Um, And generally, dysbiosis, which is just when the microbiome isn't very happy, so dysbiosis or inflammation in the gut will cause imbalances in the chemicals in your brain, okay, which will start to cause things like anxiety and irritability and depression and brain fog. Okay. All right, and then we also talk about the immune system. A whopping 70% of the immune system is in the gut. So if your gut isn't working very well, you are going to start to get sick more often, and there's going to be widespread inflammation going on. Okay. So something that we'll talk about quite a lot this evening is called leaky gut, which is what I'm talking about when I say a compromised gut. When there's leaky gut, we get massive inflammation in the body, and then that kind of just starts a domino effect. It starts to throw everything else off. And when you have chronic inflammation of the gut, it actually increases your risk of developing mood disorders, autoimmune diseases, fatigue, and an endless list of systems. But frankly, in most of my patients, there is some kind of component where we have to treat inflammation. Okay. All right. And then hormone levels. Obviously, we're going to be discussing that tonight quite a lot as well. But the gut plays a very big role in regulating hormone levels, which means when the gut isn't working very well, there are going to be hormonal imbalances. Okay. So the hormone that we look at the most, obviously it plays a role in all the hormones, but the hormone that we look at the most is estrogen, because the liver and the gut are responsible for clearing out excess estrogen. When estrogen is high, we can get something called estrogen dominance, and then we'll start to develop things like PMS and painful periods, breast tenderness, mood swings, that type of thing. Okay, so basically, if your gut isn't very happy, your hormones probably aren't going to be very happy either, and your brain also is going to show signs of imbalance. Hey, all right, then we get to hormones. Okay, so think of hormones like the teeny tiny little messages in your body that's kind of communicate between the different symptoms. They tell them how to do things, when to do them, um, and pretty much what to do. So you can see from this list over here that hormones are pretty much responsible for regulating anything you can think of, right? When hormones are in sync, you feel fantastic. When they are not in sync, you will know all about it. Okay. Um, so for example, okay, sorry, that's the next slide. All right. So the first one we're going to look at is estrogen. Estrogen is super famous. It has quite a bad reputation, unfortunately. But we need estrogen. Ask any menopausal woman how they feel when estrogen starts to drop, and they will tell you estrogen is very important. Um, the problem comes in when obviously there's an imbalance in estrogen. Okay. So, like I mentioned earlier, the liver and the gut are responsible for clearing out that excess estrogen. Okay. Remember that we're exposed to estrogen quite a lot in our environment. So often there will be higher estrogen than we need, so it needs to be cleared out, and that causes something called estrogen dominance. So when you have too much estrogen, you'll start to develop things like mood swings, breast tenderness, PMS, those types of things. If you have too little estrogen, it's going to cause low mood, poor focus, vaginal dryness, fatigue, and many, many, many more symptoms. Okay. Another important consideration is that estrogen interacts with serotonin, so imbalances in estrogen are going to show up as anxiety and depression, which again we see in our menopausal patients as well. Okay, all right, and then progesterone, also a very important little hormone. So progesterone is often called the pregnancy hormone. And what happens is after you ovulate, if you ovulate, okay, estrogen is going to rise, okay, which is why you feel so much better, okay? So estrogen makes you feel nice and calm. It helps with sleep, stabilizes your mood, that type of thing. So after you ovulate, it's going to rise. But when you are stressed or if you are not ovulating, it's going to drop quite a lot, okay? We're going to talk a lot more about how the stress is going to cause that drop. But just in regard to ovulation, if you have, for example, polycystic ovarian syndrome, it means that you aren't ovulating as often or you're not ovulating efficiently, which means you're going to have that low progesterone. But also, if you are on the oral contraceptive pill, it suppresses ovulation. So you're likely going to have low progesterone there as well. And when you have the low progesterone, causes things like irritability, poor sleep, etc. Okay, pretty much that week before your period, that is what low progesterone feels like. So it's a good way to remember that. Okay. All right, so then we get to cortisol. So cortisol is the stress hormone. It's also got quite a bad reputation because, again, when there's imbalances in cortisol, you know all about it. Okay, so we need cortisol. So it is meant to spike in the morning and lower at night. So it makes us feel nice and awake in the morning, and then at night it helps us to kind of ease into sleep, right? When we are chronically stressed, cortisol is consistently high, okay, which is what we don't want. It's not supposed to be high all the time. It's supposed to spike, right? And that's when you feel wired. Or if you are chronically stressed for a long period of time, cortisol starts to run out, and that's when we get burnout, okay? The problem that comes in is cortisol isn't only related to how stressed you feel, it affects pretty much anything. So it's going to affect your blood pressure, your thyroid, your sleep, your gut lining, and sex hormone production. So there's a massive overlap between cortisol and all the other systems of your body. Okay. All right. Then let's chat about the brain. Okay. So when we talk about just mental health issues in general, we tend to only look at the brain. But that kind of, it's like a superficial treatment, right? And yes, the brain absolutely plays a role, but there's a lot more to it in most cases. Okay, so we look at the gut-brain axis, which is what this picture is showing. And it's basically a two-way communication between the brain and the gut. So the main highway where messages are sent is called the vagus nerve. But there's also neurotransmitters and hormones and those types of things that play a role as well. Um, so basically what it means is your brain talks to your gut and your gut talks back to your brain. Okay. So why is this relevant? When you are under stress, okay, now remember, your brain doesn't know the difference between being chased by a lion and a deadline at work. So when you are under stress, what happens is blood is pulled away from the gut, okay, which means that digestion is going to slow down. It increases permeability of the gut lining, which is fun short term, but it creates issues long term. And the microbiome composition changes. Okay, so short term, that's not a problem. We need that. Okay, so basically what happens is the body is saying, we need blood in the muscles because we have to run away from this lion, um, but it's going to take away from digestion. So it starts to cause issues. But at the same time, when there are issues in the gut, it's going to affect the brain, like we discussed in the previous slide. Okay, so essentially, gut issues are going to cause mental health issues and vice versa. Okay, so when the brain is kind of what sounds the alarm that something else is going on. So that's where we will notice the symptoms first. Okay, so for example, when progesterone is low, you won't know that progesterone is low until anxiety starts to show up, for example, or feeling foggy when there's not enough serotonin, or irritable when sugar spikes. We've all had that hangry irritability. So it's the brain's going to show you when there's an issue, when it might be as a result of something else going on. Okay. All right. Fantastic. So what do we do about it? So I'm going to be discussing mainly diets and lifestyle. I'll mention a few supplements, but it's very difficult because obviously every person is different and not all supplements are a good idea for everyone. They might interact with something else you're taking. Um, for example, something that people always think about with gut health is they go on a probiotic, but there's quite a few conditions that will be aggravated by a probiotic. So it's just, I'm going to mention the supplements, but please approach them with caution. Okay. All right. So let's start off with the gut. All right. So before I start, let's chat about what the microbiome is. So the microbiome is this beautiful ecosystem that lives in the gut of microorganisms. Okay. So it's not just bacteria. It's also like viruses and yeasts and all sorts of fungi as well. And we need it. Okay. So obviously you get the good ones and the bad ones. We need the good ones. We can't really do much without them. Okay. So when we start to address gut issues, there's a few different components that we can look at. The first one is to repopulate the gut. Okay. So we want all those little good all the good microbes. We want as many of them to kind of balance everything out. Okay. So this is the approach when you take a probiotic. But I think a good approach is always, no matter what condition you're dealing with, if you can get it through diets, cool, not a problem, because you have to eat anyway, so you might as well. Okay. So when we talk about the probiotic foods, they're essentially just fermented foods. So it's the actual live microbes are in those foods. Okay. Um, Something to note with this is when you start a probiotic or probiotic foods, it can cause quite a lot of bloating. So start off slow, like very slow, because it can be quite overwhelming for the gut. Okay. So these are a few examples of probiotic foods. The first one is sauerkraut, kimchi, kefir, plain yogurt, miso and tempeh, and kombucha. Okay, so in general, when you're looking at probiotic foods, you want the ingredient list to be as short as possible. Okay, you don't want any additives or preservatives or anything like that. So generally, the kind of words that you look for on the labels will be raw, unpasteurized, unsweetened, that type of thing. Um, you also, in general, specifically for, okay, pretty much all of them, you want it to be the refrigerated version. Because, for example, sauerkraut, you can find it in the aisles with like the gherkins and pickled onions. That's not great because there's something in there that's preserving it, which is why it doesn't have to be in the fridge. So the ones that are found in the fridge are generally better as a probiotic. Um, yeah, when we start looking at things like yogurts, I get a lot of questions about yogurts, about, what type should I be having? Definitely unsweetened, full fat. So when we talk about the whole argument of full fat versus low fat, basically the basic rule of thumb is you want it as little processing as possible. So when you have low fat, we've had to take it away from the original. Okay, so obviously when you buy it in the shop, it has been taken away from what it should be originally anyway. But we want to avoid as much of that as possible. So when it's full fat, first of all, you get the benefits of fats. We need fats. Okay, your hormones need fat, your heart needs fat, everything needs fat. Okay, the good fats. But when we go to the low fat, what that generally means is they're taking out fats and added sweeteners, which is a problem. So that will increase inflammation and blood sugar spikes and that type of thing. So in terms of yogurt, it must be plain, so no sweeteners added and full fat. And then with kombucha, I know it's widely available in the shops, but they often add quite a lot of sugar to it and flavorants. So it's actually best to make it at home if you can. Yeah. All right. Then the next aspect we looked at is, okay, so now we've put those little creatures in your gut, for lack of a better term. We put those little creatures in your gut, and now they need food. Okay, so there's different foods that work really, really well to feed the microbiome, for example, onions, garlics, leeks, etc. Um, a really interesting one here is cooked and cooled starches. Okay, so I've mentioned here potatoes and rice. It also works for pasta. But basically, what happens when you cook starches and then allow them to cool down, it actually changes the structure of the starch to make what we call resistant starch. Now, resistant starch is exactly what it sounds like. It's resistant to digestion. Okay, so that means it's not absorbed immediately to create sugar spikes. It stays around in the gut for a longer time so that it can feed those little bacteria and yeast and that type of thing. And we want more of that because that's going to help with all aspects of digestive and hormonal health. Okay. Just make sure when you reheat it that you don't boil it again. You can slightly reheat it, but just don't reboil it. And it's really nice with meal prep, for example, because then obviously it's being allowed to cool down in the fridge and you eat it later. So that's just a cool fact. All right, and then removing irritants. Okay, this is a tough one. We're going to chat more about this later, but in terms of gut health alone, let's just look at inflammatory foods for now. Okay, so inflammatory foods can cause leaky gut. Now, when we look at the little cells that make up the gut lining called the enterocytes, what happens when there's inflammation is they literally cause little gaps between them. When those little gaps happen, things can leak out of the gut into the blood, which obviously we don't want. There's all sorts of toxins and things that we don't want. Our body's trying to get rid of them. they are now leaking into the blood. So you can understand why it causes massive inflammation all over the body. So foods that need to be avoided is your seed oils, which a lot of people know about, your high fructose corn syrup, refined sugar, processed foods, alcohol, and in some, so where it becomes more personalized is some people need to avoid dairy and gluten and that type of thing. But that's very much listening to your body. So if you know that you can have gluten, you don't have a problem, then it's fine. You don't need to avoid gluten. But if you know that you have gluten and you kind of get like a bit of diarrhea and bloating, you probably are sensitive to it, so it's causing a reaction. So a big part is, and a lot of my patients will know, a big part is listening to your body and then kind of following it from there. Okay. And then the next one is supporting the gut barrier. So I mentioned those little cells. That barrier needs to be nice and strong to prevent that inflammatory pathway that I mentioned. So things, foods that are really, really nice, or foods and supplements that are really nice to support that barrier is bone broth. So bone broth contains collagen and gelatin, which is really nice. It literally like coats the gut lining, and it's just very soothing and helps to protect it. L-glutamine is lovely. What it does is it's the preferred fuel source for those little enterocytes, the cells that make up the gut lining, which means that it helps the gut to bounce back and it just makes it heal faster. Okay. Then zinc, this can be in your foods or it can be a supplement, whatever you prefer. And this is just because it's been proven that zinc deficiency worsens leaky gut, but it also slows down healing. So in general, zinc deficiency is going to cause delayed healing. Just something to keep in mind. Then omega-3, so omega-3 in general is anti-inflammatory, so it's just going to kind of counteract that inflammatory response, which is lovely. And then polyphenols. So polyphenols are basically just compounds in plants, and this is the one that needs to be focused on the most, okay? The reason for that is because these little polyphenols that we find in plant compounds, so in our veggies and our fruits, they actually feed the microbiome, okay, and they also help to protect the gut lining from damage. So it's extremely important that we have our fruit and veg, even though a lot of people are quite resistant to that one. Okay. All right. Okay, cool. Then we get to hormones. Now, kind of the general rule of thumb, if you want happy hormones, you need stable blood sugar, right? So there's like a few little tricks you can do for that. There's supplements, there's all sorts of things, but I'm just going to mention more on the food side of things. So when you are trying to avoid these sugar spikes, something you can do is in your meals, try to have fiber, protein, and fat because it's going to prevent that massive spike, right? Obviously, your carbohydrates is going to be more of a spike, but if you have your fiber, protein, and fats, it's just going to help to kind of regulate things a little bit more. It's also really helpful to have protein-rich breakfasts. It's just for your hormonal health, for your metabolic health, for everything. It's just a really good idea. Okay, then, so the concept of hormone recycling. Okay, so I've mentioned it with estrogen, but basically, what the whole concept behind it is when the gut is sluggish or inflamed, we get something called hormone recycling. Okay, so that means that your body's worked really hard to clear out these excess hormones, so excess estrogen, for example, and it's ready to leave. But if your gut isn't working so well, it's going to be reabsorbed. So everything that you worked so well to get rid of is just going to be reabsorbed, and it's going to start causing things like estrogen dominance. Okay, and then you'll start to get the PMS, acne, bloating, that type of thing. And to kind of help your body along with that, cruciferous veggies, so like broccoli, cabbage, that type of thing, and fiber is amazing to just assist the gut with that part. Okay, then the brain. Okay, so we've spoken a little bit about the microbiome. The pre and probiotics that feed the microbiome. Okay, so those little creatures in the gut, they are going to produce the neurotransmitters that the brain needs, like serotonin, for example. Okay, so that's why a happy gut leads to a happy brain, or part of it. Okay, if we have leaky gut, like I mentioned, when those little gaps open up, if we have leaky gut, what's going to start happening is we're going to start getting foggy thinking and fatigue and mood crashes. So a way to kind of counteract that is to manage the inflammation caused by the leaky gut. Obviously, we're going to repair the gut as well, but when we manage the inflammation being caused by that leaky gut, then it kind of helps with the mental symptoms of it. All right. Okay, cool. Now let's chat a little bit about lifestyle factors that you can consider. Okay, so the first one is quite a difficult one, is stress management. So the reason for this is when you're stressed, like I mentioned, a whole cascade of reactions happen. But what happens at the end of that is the gut is inflamed. So the longer you're stressed, the more inflamed your gut is going to be. And then it causes hormonal imbalances as well. So just to explain a little bit about that, your body is going to prioritize running away from a lion over reproduction, right? So if you stress for a long period of time, then the little building blocks for your reproductive hormones, they're not going to be considered that important. Everything is going to be shunted towards cortisol production. So your progesterone levels are going to plummet, for example. So it causes a lot of hormonal imbalances in the other aspects as well. Okay. So in terms of stress, I know it's impossible to just say, just manage your stress. Stop stressing. Don't we all wish that was possible? But there are ways you can help your body to cope with it. So there's techniques that activate the vagus nerve. And basically, when the vagus nerve is activated, we're kind of tricking our body to say that we're not actually that stressed, we're nice and calm. Okay. Examples is box breathing. So basically, breathing in for 4, holding for 4, out for 7, right? So that's a really nice technique. Also, things like cold plunges, which more and more people are doing now, which is lovely. Cold plunges are really good to activate the vagus nerve, so the parasympathetic nervous system, and humming as well. So humming is lovely to activate the vagus nerve. And then journaling. So that obviously brings in more the psychological theory. It's kind of just getting it out, putting it on paper so it's not all just sitting in your head all the time. So stress management is a big part of supporting, obviously, hormonal, gut, and mental health. Okay. Then sleep. All right. So basically, when you are sleeping, that is when your gut is repairing, your hormones are rebalancing, and your brain detoxes. So if you are not sleeping, it's kind of like your body is not having a chance to reset, and it causes a lot of issues. So women need more sleep than men. It's been proven. It's very difficult to get enough sleep. So I recommend that everyone needs to be getting between 8 and 9 hours a night, which most people aren't, unfortunately. And it's actually been proven that for hormonal balance, you should be going to sleep before midnight. Okay, so for example, you should be going to bed at 10, for example, and then getting your 9 hours after that. Yes, and then obviously prioritizing restful sleep. And if you are battling to sleep, doing things like avoiding blue light before bed and having a bedtime routine and that type of thing. Okay. All right, movement. I cannot emphasize enough how important movement is for all aspects of the body. Um, it improves your gut motility. First of all, it helps with insulin sensitivity, it helps your mood. And I mean, you can feel that after you've exercised, even if it's just like super chilled, like walk around the block type of thing, you feel better. It improves all sorts of aspects. So, in terms of specific recommendations for exercise, I think what's most important here is consistency. A lot of people will exercise like crazy for a week and then they're too sore to move next week, so they don't go back to gym type of thing. So starting off small and seeing what works for you. So listening to your body. So for example, a lot of people will start with high intensity training. That is not a good idea if you're in burnout, for example, if you have or if you have hormonal imbalances. It's going to cause all sorts of issues. So after you've done an exercise or during an exercise, like listen to your body. And if you are really not enjoying it and you feel like you're gonna fall over, maybe that exercise isn't for you. So then you go for the gentler one. So in general, I say at least once a day, have like a gentle exercise. So whether that's walking or yoga or stretching or just like Pilates, something a little bit gentler that kind of a lot of like women like dancing, that might be something that could help. And then women need to be doing strength training. So obviously there's lots of aspects involved there, but even if it's just twice a week, and it doesn't have to be super hectic, like you don't have to be a weightlifter, but even if it's just like body training exercises or like resistance bands and that type of thing, but you need to be building up that muscle strength and the bone strength as well. So even if it's 2 to 3 times a week, literally 30 to 45 minutes is enough. You shouldn't overdo that one, because that's when you'll be so sore that you won't want to come back to gym. And then for women who are still menstruating, a really important consideration is cycle syncing. So kind of listening to your body, and in the first phase of your cycle, doing the higher energy, higher intensity exercises, and then the second phase of your cycle, calming it down and don't push yourself too hard. And again, just listening to your body. Okay, sunlight. All right. So in the mornings, if you have exposure to sunlight within 30 to 60 minutes of waking, what it does is it helps to regulate your hormone levels, but it also helps with sleep and circadian rhythms and those types of things as well. It regulates cortisol. The difference is you shouldn't be wearing sunglasses, and there shouldn't be glass. So even if you're sitting inside behind a window, you're not really going to have the benefits of it. So first thing in the morning, if possible, get outside, have some sunlight in your eyes, and it's really going to help you. So it's going to cause an increase in cortisol, so it'll help you wake up. And it's also going to help you to go to sleep at nights, because your body's naturally going to it's going to decrease those cortisol levels because it had that increase in the mornings. Okay. All right. Then, this is a tricky one, but it's an important one. We need to decrease our toxin load. So pretty much everywhere we're exposed to toxins, whether it's in our like our body products, or in our food a lot of the time, in our cleaning products. So it doesn't have to be perfect, but just like slowly, just starting to make choices to avoid as many toxins as possible. So little things you can do is opting for fragrance-free products, the more organic, natural products. There are a lot of people battle to move across, but even if it's just like changing one product, and then kind of building from there. Then avoiding parabens and phthalates, BPA. So for example, plastics are a very big problem. So what we spoke about meal prep. So when you're doing your meal prep, make sure you have glass containers, because when that food's sitting in that plastic for a long time, it's going to absorb all those microplastics. So kind of those small choices. Also another one is Teflon in your non-stick pans, trying to avoid that, because all of that's going into our food, unfortunately. Okay. And then in your cleaning products, trying to go for the more organic, natural ones as well. And for those, you can use things like vinegar and bicarb and lemon juice and that type of thing. It doesn't always have to be the hardcore cleaning products. Okay. And then snacking is also a bit of a problem when it comes to gut health. So there is something called the migrating motor complex, or MMC for short. And basically what is it? It is it's like this cleansing wave that comes along after we eat something, and it kind of picks up all the excess or the leftover food and bacteria and debris and that type of thing, and we need it to kind of, whoosh everything along. But if you go and have a snack an hour after eating, it kind of interrupts that process. And what happens is we then have debris that's left behind, and it's going to cause bloating and inflammation and those very unpleasant symptoms. Okay. So I do have to point out again, the aim is not perfection here. You are not going to get all these things 100% right, but it's just like small choices, small changes that suit you as well. So looking at your lifestyle and saying, okay, this would work for me, this wouldn't work for me, but it shouldn't feel completely overwhelming. You should be working with your body, not against it. Okay, all right. So obviously this was an educational webinar, but if you feel like this was super overwhelming or confusing and you want more of a personalized approach and you want to chat about it, I do offer one-on-one consultations. So if that is something you'd be interested in, Kieran, if you can just pop my details in the chat, or even if you just have any questions, just pop me an email or contact me on my website and I'll get back to you.